Moral dilemmas in social work. Moral dilemma 1. Caroline. Caroline was convicted of neglect of her twin babies when she was 21 years old and was given a 2-year non-custodial sentence. Both babies have no other family willing to foster or adopt them. The father was not involved in the care of the babies at all, so both babies ended up being adopted. As a result of Caroline's conviction and her severe mental health issues, including anxiety, depression and substance misuse, Caroline was given over 2 years of support with a mental health social worker called Patricia. At the age of 24, less than 3 years after the twins had been adopted, Caroline fell pregnant. Patricia had now become a team manager of a childcare team in the social services department. She was informed by Caroline that the father of the third baby was the same father as that of the twins, and that now was being supported by this partner and her own family, including her parents and sister. The new child care social worker in Patricia's team makes a positive assessment of Caroline after meeting several times. The risks. The risks involved in this pregnancy and for the unborn child include the fact that Caroline is unwilling or unable to recall any details about the birth of her twins and the subsequent events that led to their being taken into care. The birth of this third child could trigger Caroline's mental health problems and act as a catalyst for a new mental health crisis. No one can be sure what the reaction to the actual birth of the baby will be, despite the fact that Caroline is happy during her pregnancy. No one can be sure of what actual support the partner and family will give Caroline once the baby is born, as there was no support in the past, and so no what evidence is there or reassurance that things will be different this time. The plan is devised that Caroline will attend antenatal classes both at the hospital and with social services support. Caroline will be admitted to the family unit of the local hospital for assessment following the birth of the child, where excellent mental health support for young mothers is available. A social worker will be allocated directly for the unborn child, so as she is present as soon as the baby is born. Unfortunately, funding is withdrawn at the last minute for Caroline's placement in the family unit of the hospital, raising the serious question as to whether Caroline would be able to look after the baby well enough to keep her and manage by herself at home. Meanwhile, news comes to light that there have been reports of antisocial behaviour at Caroline and her partner's address, and the GP has reported that Caroline is smoking and drinking during the pregnancy. Decisions that need to be made. Patricia and the social worker have to decide whether the baby should be removed directly after birth. Would other family support services be available to Caroline once the baby is born? The ethical issues involved primarily concern the rights of the service user, Caroline in this instance, which is the Kantian principle of the respect for the person. Is Caroline capable of rational and self-determining action? Is the unborn baby a service user? The rights of the child must be taken into account. The interests and welfare of the service user. What are the user's best interests? Do we take account of Caroline's views of her welfare or others' views? The unborn child. We need to take other people's views into account, although the baby cannot give views for herself. The rights, interests and welfare of others. Other parties involved include the partner, parents, other mothers and babies, the hospital and professionals involved. What are their rights and interests? The utilitarian principle of greatest good to the greatest number of people and distributive justice are raised here. Equality and justice. How are pregnant young women, people with convictions or psychiatric problems regarded in society? How are they treated by powerful professionals? Is Caroline being unfairly discriminated against because of her past? Considerations in order to come to a decision. Does Caroline have a right to look after her baby after its birth? Is Caroline likely to neglect her baby after birth? What is in Caroline's best interests? What are the rights and interests of the unborn child? What are the rights and interests of other parties involved? Is Caroline being treated fairly? So then we come to the decision. Patricia decided to recommend the social services should supervise the young woman and child from the moment of birth, but that the baby would not be removed. Patricia was concerned to respect Caroline as a person, an individual with the right and capacity to make her own choices. Patricia wishes to promote Caroline's capacity to be self-determining by offering support, the Kantian principles. Risk of harm to others, the utilitarian principles, were not great enough to outweigh Caroline's rights and interests. The decision. Patricia's particular relationship with Caroline enabled her to implement and prioritise her duties and principles. Patricia's knowledge and understanding of the situation, her professional judgment, sense of fairness and justice, determination and commitment to support this person, along with her qualities or virtues and relationship with Caroline, are important features of this outcome. Dilemma 2. Mr. and Mrs. Bates, an elderly couple. Mr. and Mrs. Bates are an elderly couple aged 94 and 87, respectively. They have both been known for some time to be struggling with impaired memory, and recently the warden of their sheltered accommodation has reported that he has noticed they have been struggling with everyday tasks more and more, such as the shopping and the cleaning, and they're becoming less sociable, attending fewer of the activities in the sheltered housing unit. In recent weeks, Mrs. Bates has fallen several times, and an ambulance has had to be called to assist her getting up again, as Mr. Bates cannot lift her alone, and the warden is not always on hand to assist. Mr. and Mrs. Bates are supported by a large extended family who are all of the view that they should now go into a care home. Mr. and Mrs. Bates are admitted to a care home one evening after another fall, but on admission, both Mr. and Mrs. Bates are adamant that they wish to return home. All parties involved include Mr. and Mrs. Bates, Mr. and Mrs. Bates's family, the sheltered accommodation warden, and Mr. and Mrs. Bates's social worker. Kantian principle. Mr. and Mrs. Bates should have the right to choose whether they go into the home. Mr. and Mrs. Bates's family have the right to be considered as they are concerned for the best interests of Mr. and Mrs. Bates. The warden at the sheltered accommodation has a right to be considered as he is responsible for the well-being of residents. The social worker has a professional judgment and experience, acting in the best interests of all parties. So the considerations. How much can Mr. and Mrs. Bates be expected to be able to make an informed choice due to their mental capacity? The Kantian or utilitarian principles, the rights of the users or the rights of all concerned. For the social worker, there is no moral dilemma, as she is convinced acting in the best interest for what Mr. and Mrs. Bates wants is the only real consideration. This stresses principles of user determination. Mr. and Mrs. Bates absolutely have the right to choose what is best for them. Dilemma for the family members, however, as to what is in the best interest of Mr. and Mrs. Bates, as going into a care home is so against their wishes. Family members and the warden see it as a dilemma. Do the users understand the risks they are taking by returning home? What level of support and responsibility is it fair to place on the warden? How much support will family members be obliged to give Mr. and Mrs. Bates if they stay at home but are unable to cope with everyday living? What if Mr. and Mrs. Bates deteriorate suddenly and moving into a care home becomes much more difficult? Is it fair on each of Mr. and Mrs. Bates in terms of the responsibility they may feel for one another, but their inability to take care of each other? The social worker agrees to take into account all wishes of the family and warden, and also uses professional judgment and medical opinion as to the mental capacity of the couple. This decision is made that Mr. and Mrs. Bates, against their wishes, should enter the care home, as it is in the best interest of most of the people concerned, and the impairment of the couple's memories and early signs of dementia mean that medically and professionally it is wisest the couple should be looked after full time. The utilitarian principle and the casuistry principle, where case-based experience says that the couple will require more and more help.